Osteoporosis develops slowly and can be prevented, but you need to be screened and take proactive prevention steps. Dr. Carrie Peterson is here with more.
For most of us, our bones are their strongest in our early 20s. That's because about 85 to 90% of adult bone mass is built by the time you're 18 years old as a woman and 20 years old for men. We also know that as we age, all of us will lose some bone mass or density. That's why it's so important to keep track of bone mass with regular screenings. The National Osteoporosis Foundation has issued guidelines that call for all women over 65 years old to have their BMD, or bone mineral density, measured by a doctor. Women with a higher risk should be tested earlier. Men should also be screened. The American College of Physicians recommends men at high risk should be screened by age 65. Remember, 20% of all osteoporosis cases occur in men. Now, there are three main BMD tests used today. The first is called DEXA, which is short for dual X-ray absorptiometry. This is the most popular test because it's a very accurate test. It uses X-rays to scan important bone sites like the hip, vertebra, and wrists. Your results will be compared to the normal range for people who are the same sex and age. The next test is called quantitative computerized tomography. This is a type of CAT scan, but this test can be expensive and doesn't track the progression of osteoporosis as well as a DEXA. And finally, ultrasonography can be used to determine BMD. During this test, your doctor will look at your heel bone with a sonogram machine to determine your risk of fracture. If these tests show that you have lost some bone mass, your doctor may suggest some preventative steps. The first is making sure your diet includes enough calories, calcium, and vitamin D. Premenopausal women and all men should have at least 1,000 milligrams of calcium per day. After menopause, women should have 1,200 to 1,500 milligrams of calcium per day. A daily intake of 800 units of vitamin D is also recommended. It's best to get these through the food you eat, but a daily supplement may also work well for you. If you smoke, you will be asked to stop. Smokers' bodies absorb less calcium from their diet than non-smokers. Protein supplements may be suggested for those who have already experienced fractures from osteoporosis. You may also be asked to limit the use of alcohol, caffeine, and salt. And finally, your doctor may have you start walking, hiking, or stair climbing. These are called weight-bearing exercises because your bones are holding or bearing the weight of your body. These are great for your muscles and even balance, which could help you avoid falls and accidents. You may also need to start lifting weights, which is called resistance exercise. These help build the muscles that surround your bones. Think of these muscles as a girdle or support system for your bones. Strong muscles mean strong support, and that can help prevent breaks and fractures. These types of exercises are great for people with osteoporosis, but also they're excellent prevention steps that you can start early.
Osteoporosis doesn't have to happen to you. Get screened and take these prevention steps to keep your bones strong and healthy.